Remind me to report. So, sorry, your station will not be recorded, Dr. Aya, though it is good. So sorry for that. But anyway, whenever you are practicing, try to record your performance to see what the examiner will see. Okay, let's see. You had very good empathy in the beginning, as you said, in the very first, and maybe in the first half you were very organized, very fluent. In the second half, you were struggling to achieve the task. I don't know why, and it was added. The complexity was added by this distraction. But all in all, it was good. You succeeded to finish at the end of the station. In the second half, you were a bit disorganized, but in the first half, you were organized. Let's see, according to our so this is my notes. You are not obliged to follow my notes, but you're obliged to finish the task according to the mark sheet, which is should be submitted to the examiner. I don't have it here, but the mark sheet of the mental state is very close to the mark sheet of the history taking task. Okay, so whenever you are practicing, make sure that you assess yourself and the performance of your colleague according to the mark sheet. Okay, very important, doctors, to have introduction. You did have a good introduction, and pay attention to the setting. This is someone who is brought by the police. So definitely this is not a very comfortable situation. You can start by saying something like, hello, Mr. X. I know that this can be an uncomfortable situation being brought by police, but I'm here to help you. So put you in your mind and show to the examiner that you understand what goes on. Okay? Complain. Very good that before she starts talking about the psychosis, she also understands the context that this man is hurt in his hand, and she showed empathy and she asked him about the wound. The very first thing which you should do, which will help you also in being showing that you are organized and you understand how you start talking with a patient. Whenever you talk with a patient, the first thing you do is to hear his complaint. So whether it is a mental state or a history taking, we don't just ask him, do you hear voices? Do you see things? This is not the best way to start anything. So you want to hear from him his complaint, and there is a particular construct to the complaint, how you take the complaint. So you want to know, when did this start? Okay, and how did it start? Did it start suddenly? Okay, what happened? Nobody wakes up in the morning with a psychosis, so definitely something happened at around the start. Okay, and the course. Okay, so is it increasing with time? Is it decreasing? So you asked me about when did it start, but you did not ask me about the course. So what happened next? Do you feel with time that they are still taking your thoughts? How did they interfere with you in any other way? What did you do? So we want to know the course. It's not only about increasing or decreasing. There are different issues in the course, okay? And before the onset is a very important issue now in the, pay attention and mark these words. The Royal College highly appraised now the candidates who pay attention to the predisposing and precipitating factors. As I said, nobody wakes up in the morning with psychosis. So you want to know, it all started 6 months ago. So I'm wondering, how were you doing before that? Was he on taking drugs? Was there any sort of delusional mood? Was he is on a medication? So you want to know what's going on, what was going on in his life before the 6 months. And this will give a very good impression. Dear doctors, please mute your mics if you don't mind. Okay, so this is the first thing you do when you start talking with the patient, whether you are taking history or we are taking a mental state. Take the complaint, okay? And while you're taking the complaint, you're also assessing the mental state, because he will talk to you about a delusion, a psychosis. So this will be a part of the mental state also. You'll cover very important parts of the mental state before jumping to asking questions about the delusions and hallucinations. And when you take the complaint properly, you will understand what area which you are going to work on. Now we understand after taking the complaint that this is a psychosis, it is not a mood. So the first thing you should do after taking the complaint is to take the psychosis thoroughly. And there is an acronym here which helps me, and you can have your own acronym. PPBIC, it stands for persecution, perceptual disorder, broadcasting of thoughts, and thought insertion and control. So these are 5 to 6 points which you are going to cover if you have this acronym. And definitely when you cover the psychosis in this depth, definitely nobody can say that you did not cover it thoroughly. Okay, so according to what he said to you, you can start by any point here. If he was talking about the auditory hallucinations or about the laptop control, pick up the point which he is talking about and start assessing your the psychosis accordingly. So he will talk too much about the laptop, so you can start by the control and thought insertion and withdrawal, the broadcasting, which you did not ask about me about Mrs. Dr. Aya. So this is a point which you have missed. And also in the onset, you didn't ask me how was I doing before that? Was I taking drugs, delusional mood? So this is an defective in your assessment. You must assess the complaint in a good way. It's not about how did it start and how methods went on like after that. You want to know before the onset, how was he doing also. Okay, and then the mood, not very important. If you don't have time, I don't think if you missed it, there won't be any problem. Okay, but pay attention that you should cover the psychosis thoroughly. Cognition is very important if the patient is elderly. Pay attention to the age group of the patient which you are going to talk to. In the mental state, if the patient is elderly and you forgot the cognition, this can be an important point. If the patient is a youth and you forgot the cognition and you didn't do it, it is not very important. Okay, so pay attention to the cognition, particularly if the patient is an elderly or if the patient is related to something which can impair the cognition, like the depression in particular and the mania. But in psychosis and youth, forgetting to ask about the cognition will not be a very important issue. Again, in the risk and assessment, you forgot to ask me about whether I'm taking drugs or no. Very important. Did you ask me about taking alcohol and recreation drugs? So very important. At this particular age group, most probably they can be taking something which can change the state of mind. Insight, you asked me about the insight in a very good way. Termination, okay, you said a psychotic episode. You don't need to diagnose. It is not a station which you can come out with a diagnosis, but eventually you terminated the station, and this is a very good point in your side that you terminated the station and you succeeded to finish the task in 7 minutes. They like the candidates who are very organized and can finish the task in 7 minutes. Okay, this is a point which you are going to be assessed by, and it is challenging actually that you finish the task in 7 minutes. So pay attention to the time frame, and you should practice too much in order to make sure that you can finish the task in 7 minutes. Thank you so much, Doctor. I hope that.
Can I ask a question?
Yeah.
Regarding the mood, I know it's irrelevant here, but I was trying to get to the risk of harming himself or something like that. So do we just cut into directly? Is it okay to say that stress brings out, like in your sheet, that brings out suicidal ideations or harming themselves? Can we directly go into without like asking about the mood and all of that?
Well, I said that if you forgot the mood, this cannot, but if you ask about the mood, it will be better. Okay, so I'm just giving you an idea about how you are going to be assessed in this particular station. There are very points which are more important and points which if you have missed, this will not affect your passing grade. But if you are going to assess the mood here, don't forget about the 2 main questions. Mood in the past 2 weeks and anhedonia. Okay, that's it. Not enough to assess the mood by asking about the risk of suicide. Suicide is not a way by asking. If you want to assess the suicide, this is a different issue other than assessing the mood. Okay, so don't mix up these things. Okay. Okay, let's see our colleagues if anyone has added anything. Do we need to do onset duration? Yes, doctor. Yes, Dr. Santosh, because as I said, when you start talking with a patient, what are you going to talk with him about? What? So you must have a plan in your mind. You want to hear from him the complaint, and while you are taking this onset course duration and etc., you are also assessing his mental state. You want to know more about the delusion. When did it all start? Is it increasing? Is it decreasing? And how was he doing before that? Are you taking any? Were you taking any drugs? So this is points which definitely will add to your knowledge about his mental state. And actually, you cannot draw a line, clear line between what is requested from you in the different tasks. Sometimes while you're doing management stations, you can ask some questions related to the history. While you're doing the mental state examination, you can ask also some questions related to the history. So, okay, don't just have, as I said, it's up to you. If you are not very happy with my approach, okay, it's up to you. You can have another approach, but I don't know how you are going to start talking with the patient if you are not going to start by taking the complaint in an organized way, okay? And make sure at the end that you finish the task. This is my way of doing the mental state, okay? And which helped me and helped many other candidates. If you have another way which helped you or has been proven to be beneficial, don't change it. Don't change it because I'm saying so, okay? Okay, thank you so much, Dr. Deer. So who would like to? I said some Dr. Dua. Thank you, Dr. Okay, so who would like? Yes, Dr. Dua. Yes. Dr. Dua. So what is your station, Dr. Dua?
Barcode overvalue ID.
Barcode over valid ideas. Okay. Yes. This station usually comes as a barcode psychosis, but sometimes comes as an overvalid idea. We will see what is the difference. Okay, so
Yeah.
we will start after 1 minute, doctor. And Dr. Ayman will go after Dr. Dua if anyone doesn't object. He is to be his turn. Okay, doctor, ready?
Yeah, okay. Let's.
Okay, doctor. So let's start the timer. Let's say that my name is Robin. 1, 2, 3, go.
Hello, Robin.
Hello.
My name is Dr. Ibrahim. I am one of psychiatrists, Dr. working in this hospital.
Hello.
Thank you for coming today. I have got information from your notes that your GP really concerned about you, and I'm here just to see how best we can help in that.
Well, I don't know what's going on. It was a misunderstanding, but he did not give me the chance to explain to him my point of view. I was talking to him about what we believe in Christianity, because the barcode in the test tube contained 666. I said that this is a satanic sign, and it is, some people might not be happy to have put their blood in it, but he said that I will not take any service from his facility except after talking with you. And here I am.
Okay, that's great. It seems to me that you are not happy from what's happening with the GP, but let's talk about that and see what is the reason behind his concern. Is that okay?
Okay, no problem.
Okay. Just tell me more about, you mentioned about you have to do some routine test, and the blood tube was by code 666, and you wasn't happy with that.
Yeah. This
So,
is well. I said talk to him. Well, it would be better if we had another test tube, and that's it. But it was not that big issue. But it seemed that he was very not happy with it. I can say.
Just help me understand, what do you think what will happen if you do this test with this barcode on it?
Well, I don't know what would happen. You know, I'm trying to follow the word of God. So if anything related to Satan or there is satanic sign in it, I just try to avoid it. What happens after that? Who knows what will happen to the blood? I think it will go to the lab.
Okay. And you mentioned if the blood test with another code, you're happy to do it.
Yeah, no problem.
Okay. Mr. Robin, if you can help me understand about, if you find 666 in any other place, what will you do? Something like food can or something like that?
Well, I just, it happened before, and sometimes, I try to avoid it, and if there is no other way, I just try to just do whatever it's required for me to do. But it is not the big. My life is not revolving around this issue.
So, okay, that's great. Let me know about when exactly do you start to realize that you are about 666. It's mean.
Well, with all my respect, it seems that you will not understand what I'm saying because you're not Christian. It is written in the Bible. So if you have any of your friends, you know that it is something written in the Bible, and many of the Christians people just believe in it, particularly with those who are committed to going to the church regularly. So it's not only me. There are many people in the church who also believe in it, and we keep talking about it.
So it seems that the people around you share same belief about that.
Yeah. The church, definitely. We all believe in what's written in the Bible.
Okay. And have you ever put yourself or anyone of your family at risk because of that? Maybe you found
no. What risk will be brought by this issue? Just trying to follow the word of God. How come I put anyone in risk?
It's really helpful to because you helped me understand about the situation at the moment. But I'd like to ask you about some things. It might or might not you have it. So just it's a part of my assessment. Is that okay?
Okay.
Do you feel that the people around you by any way try to harm you or control you by any way?
No. Most of the people around me are in the church and in my neighborhood. I don't have any animosity with anyone.
do you think that you are especially close to the God?
Well, I go to the church regularly, so I believe that I'm better than those who don't go to anyone who doesn't. But not because I'm better, because I'm trying just to go to the church and do what God is asking me to do.
Okay, so it's just a part of your religious. Is that clear?
Yeah.
Okay. Apart from what I need to ask about, have you ever felt that is there's any reference to you on the TV or something like that?
No.
Okay. And do you think that your thought is your own thought, or there is any interference of your thought by any way?
No, but nobody's interfering with my thoughts.
Okay. And have you ever had any unusual experience, like hearing voices when there's nobody else around you, just you can hear them?
I'm not crazy, doctor. With all my respect, these questions are not.
I do appreciate it. It's just a routine question I have to ask as a part of my assessment. Okay, or even any unusual smell?
No.
Or a change in your taste recently?
No.
Is there anything? Okay. Is there anything seem different to you recently?
No. Everything is okay with me.
Going through all of that, have you ever had any thought to harm yourself by any way?
No. Why should I? I want the GP to do my routine check out just to make sure that I'm fine. Why should I help myself?
And sometimes people try to cope with any stress by using alcohol or drink alcohol.
I'm religious.
Or using any street drug at all?
Yeah.
Okay. Thank you for all of that. So let me know about what's your explanation from what happened with the GP.
Excuse me?
What's your explanation for what happened?
Well, actually, you should ask him, because I didn't do anything. I just talked with him, frankly and casually. Next time I'll not talk with anyone in the medical. Time.
Okay.
How do you feel about what you did?
Okay, my problem in this station, I feel I go like checklisty, so I don't know how.
Yes, checklisty. Yes.
I feel that, yeah.
So we have here a list where Dr. Ayman wants to do the station after Dr. Daya, and then Dr. Henry, okay, and then Dr. Patricia. So, well, thank you so much, because actually you did something which I used to do, and it is a mistake. And I know that this is something written in your in the notes, that okay, I will ask you some routine questions. Do not be obsessed offended by it, and you go through a checklist of questions which are very, very badly formulated. And asking, do you hear voices? Anyone is following me? Anyone is putting thoughts in your mind? And do you think that this is the way we do a mental state examination? And I know that these are the way which is written in the notes in your hand, but from my experience and from what I've heard from other candidates and from consultants, this is not the best way you assess the patients. Okay, there are other ways by which you can tailor your question appropriately according to the patient experience, something which we have discussed before called weaving. Put some of the patient's experience in your question to make it more palatable and more related to his experience. Otherwise, you will be considered a checklist and you might lose your patient. In this particular situation, the role player can be very offended. So I'm not crazy. Why are you talking? And once he is offended, your passing rate, and if he's not happy, most probably he will give you negative feedback about you after you leave the station. And this is part of the assessment also, by the way. The role players are involved in the assessment, okay? So if he gave a negative feedback about you, this can be a bad thing.
Yeah, ask her to wait.
Okay, so let's see according to our sheet. Okay. Okay, so let's in the beginning, let's know what is an overvalued idea. What's the difference between it and the the normal problem of this is brainwash laptop. No, this not this one. Yeah. Okay, so if you have some, and we all have our own overvalued ideas, it can be something related to the culture or personal experience. Everyone has his own ideas and overvalued ideas, something which might not be accepted by everyone. But the difference between it and the psychotic experience of someone who has psychosis is that these overvalued ideas are negotiable, though the personally firmly believes in them. In addition, there is no deterioration in the patient's life because of them. Okay, he can be a very successful person, and he is related to an occult group who has the most bizarre uh, fanatic ideas which you can imagine. So he can be very successful despite these overvalued ideas. On the other hand, if he has psychosis, psychosis is not only about a disturbed mental state, but also a deterioration in the patient's life. Okay. And the thoughts have a solid evidence in case of an overvalued idea. There is solid evidence for these thoughts, either from the Bible or it can has an evidence from the cultural surrounding him. Okay, and although the patient's life does not show any severe declines with like this, which happens with the psychosis. So pay attention to these differences because this is part, even if you are sitting in your clinic in order to make a difference between what is psychosis and what is an overvalued ideas, because you know now everyone now has his own mind. Okay, so let's see. Your introduction was good. Your complaint, you wanted to know exactly what happened. Uh, so we want to know more about this 666. I wish that you want to ask me more about. So when did you know this idea about 666? So I gathered that it started maybe 6 years ago. And how were you doing before that? So this is part of the complaint. This is how you start talking about the patient. And actually, with all my respect to all my colleagues, I don't know how would you start talking with the patient if you do not take a complaint, and how you take a complaint without being organized and taking this complaint regarding you should take the onset, the course, the duration, and how was the patient before the onset. This is how you take a complaint. So all in all, so you took the complaint, you also only noticed about how it started. You didn't ask me how is it going after that, how was he doing before that, you didn't ask. And now regarding the psychosis, which is the most important point in this part of in this mental state, please avoid this way of assessing the psychosis. I will ask you some questions. Don't be offended. It's part of the mental state. And then you go, do you hear voices? Do you see things? This is a very, very offensive way. Do weaving. You are supposed to propose yourself as someone who is going to be a consultant, as a member of the Royal College of Psychiatrists. So definitely you must ask the questions regarding the mental state in a better way. You should know better regarding how you frame your questions. So regarding persecution, have you ever felt that anyone is after you because of your beliefs? So you use his beliefs and you incorporate it in your question regarding the persecution, other than ask him anyone is after you. This plain non-palatable question definitely is not going to help you. Like satanic followers, how did you know that if he said that there is some satanic followers? So we want to know, how did you know anyone is, and why are they doing this? And regarding the perception, again, we know that it's all about the Satan. So have you ever had any experience with the Satan, like hearing his voice or seeing him? Okay. What any other unusual experience, visual experience? Again, We do not go out of his experience because we are talking about the satanic issues. Again, when you talk about the broadcasting and session, please phrase your question and frame it in a better way. So have you ever felt that the Satan is trying to interfere with your thoughts, like putting thoughts in your mind or taking them out of your mind? What about broadcasting and making the people know what you're talking about? So again, when you phrase a question like this, definitely the role player or the patient will understand that you are tackling his experience. You're not just posing question from a checklist. If you did like what Dr. Dwyer did, with all my respect, you will have a feedback that you are checklisting. Okay. Very important to ask about the mood here. You didn't ask about it. Cognition. We don't ask about the cognition, impact, coping, and risk. Did you ask me? Yes, you asked me about it. Insight. Here, there is nothing to be assessed in the insight. If you should not ask him, say to him that you have tricks played by his mind or anything, but you want to know if this is the first time to be in contact with psychiatric services. And from my experience, I talk with the candidates who have been in this type of stations. They terminated the station exactly like this way. You have your own beliefs which are related to your religious background. It is understood and respected. I will pass my evaluation to the GP. Feel free at any time to book an appointment if you have any concerns. So we do not terminate this station by saying to him you have psychosis and it will be better to see you again in order to help you. Just give him the right to have his own ideas and you'll pass your evaluation to the GP. And if he has any concerns, you will help. Here are some visual educational materials which will help you also just to refresh your memory and refresh your idea about the differences between the thought content like overvalued ideas, the obsessions, the delusions, and so on. It will not make any difference except that when you are in the station, you'll be more confident because you understand what you are doing. Okay, thank you so much, Dr. Dua. Very good. So who would like to go next? Please, and give her some feedback. I did not hear her feedback. He is not saying it. Yes, that's risk of putting it. Yeah, yes, there is no a lot of risks here. Okay, so Dr. Ayman?
Yes.
So yes, Dr. Ayman. So what is your station, Dr. Ayman?
Postpartum depression, I believe. Postpartum depression.
Postpartum depression.
Is it mental state examination or
postnatal depression? Let's see. Well, actually, it came as a mental state examination, doctor.
Yeah.
It came once as a mental state examination. We will share the. Postnatal.
Ola, take care. Your camera is on, man. Take care. Your camera is open.
Okay. And please try to mute your mics if you don't mind. And okay. You have 1 minute. Just write down your notes, arrange your thoughts, and we'll do a mental state examination.
Okay. So what's your name?
Christine. Let's say my name is Christine. Ready?
Yeah.
Okay.
Hi, Christine. My name is Dr. Yunus. I'm one of the doctors in the mental health clinic.
Hello, doctor.
I understand that your GP has referred you. He was worried about you recently, about your mood. I'm here to discuss with you and see what is going on with you. Is it right?
Yeah. Really appreciate this.
Thank you so much for attending to see me today. I understand that you had a baby recently. Could you tell me a little bit more? When did you bought your baby and what's the baby's name?
This was about 7 months ago. His name is Michael.
Michael.
I don't know if this is something good because I don't feel that I'm able to take care of him.
I'm really sorry. It sounds like you have passing through very difficult time. So how long have you been feeling this way?
It's about 4 months.
4 months now. So 3 months after you had Michael,
Yeah,
you started feeling low.
yeah.
What about the delivery itself, the pregnancy and the delivery? Were they all right? Did you have any
Well,
complications or problems?
I had a cesarean section. The doctor said that there's a problem, and the cesarean section was a bit complicated, but everything was okay eventually. And I left the hospital after 1 week.
Hmm. Hmm. And you mentioned that you are struggling at the moment to look after Michael.
Yeah.
Could you tell me more about that?
Well, I don't know, doctor. I think that there are many things. He might get infected. I'm not a good mother, and I don't know if he can live with me while I'm like this. Whether he's going to be a happy child. I don't know, doc. Many things running in my mind. I don't know what to do.
Hmm. It sounds like you have been passing through a very difficult time. It started 4 months ago. How did it progress since then?
Well, it's getting worse with time, and I just don't know. And eventually, I went to the GP and told him everything, and he said that I must talk with you.
Right. We are here to help. So I just wonder if I asked you to score your mood in the past 2 weeks on a scale from 1 to 10, if 1 is very low mood and 10 is a good mood, how much you score yourself on average?
Well, I'm just zero, doctor.
0. And at the moment, you still feel 0.
Yes.
How's your energy level? You feel tired.
I can hardly take care of myself and the baby. I feel that I'm bound to the bed. I cannot go out.
Are you able to enjoy anything in your life at the moment?
No.
Okay. And how things like your sleep at the moment? Are you sleeping all right?
I can hardly sleep, doctor.
Okay.
And even when I'm asleep, I feel that I'm still awake.
So even when Michael is asleep, you're still awake. And
Yeah,
how's your appetite?
I lost about 5 kilos in the past 7 months, and I don't know
Mm.
if this is normal after delivery. This is the first baby.
But how's your appetite? Are you eating or?
No.
And just would like to ask, I mean, it sounds like you have been really feeling very low and it has been affected your life. Do you have any social support around?
No, my partner left me. I had a partner and he left me.
I'm really sorry. And when did this happen?
Or maybe before giving birth to Michael by 2 months.
All right. And do you have any other children around or
No.
so this is your only baby? And is there anyone who supports you in the community in at house, or do you have any close
No.
relatives living nearby or all
No.
right? And just would like to you have told me a little bit about your thoughts that you feel that you are not able to take care of Michael and you feel that you are a bad mother. How
Yeah.
strongly convinced you are about this?
I'm 100% convinced. That's why I went to the GP. I don't know what to do in this struggle. How can I take care of him and what to do? I don't know, doc.
Can I just ask you how do you see the future? Do you see any
Otherwise,
hope for
I have no
recovery?
future for this poor child. I'm a bad mother, and he had also a bad father.
And with all of this going on, has it been so difficult for you that you consider that your life is not worth living?
Yeah. Sometimes I feel that if we both died, this would be better for both of us.
And both died, do you mean you and Michael?
Yeah.
It sounds really difficult to think about this very dark thoughts. I imagine it has been really difficult for you. But I have to ask you this question. Please don't judge me wrongly. Sometimes when people are very depressed, they might have thoughts about harming their baby. Has it been the case?
No. Just thoughts that if we are both dead, this will be better if life goes on like this.
And just to ask, have you had any other thoughts about, harming your husband, your ex-husband, or trying to retaliate or anything like that?
No.
Is it the first time that you feel depressed?
1 minute. No, this is not the first time.
Could you tell me a little bit about your past history with mental illness?
I used to take fluoxetine for depression, but I stopped it.
Okay. And recently, have you been bothered, by any unusual experience, like hearing voices when there is no one around, or having any sort of unusual thoughts?
Sometimes I hear whispering, some voice saying that you are bad, you are a bitch.
Okay.
Sometimes
Do they feel real to you?
whispering, I don't know.
Okay. Do you think that your mental well-being is affected at the moment in the past 4 months?
Well, definitely, yes. I feel that I'm not good at all. There is something wrong, but I don't know what to do.
Thank you so much for being so open and honest with me. We can definitely help you in this difficult time.
Finished? Are you finished?
Yeah.
That's 12 seconds.
Yeah.
Okay, so very good, except that you should have just dig more in the area of psychosis, particularly the nihilistic delusions, and the stations in which you feel that there is high risk. This lady has high risk of definitely. So definitely you should say to him it will be better for her and much safer to stay in the hospital, and you will also help her in taking care of the baby. This point I have been given before from one of the consultants in the Oxford mock, and I feel that it's very relevant to the proper termination of these stations. Otherwise, it was very good, except that for a moment I felt that you are not going to ask about the psychosis, though if you just had a look at the role player notes, that they gave him some instructions to talk about voices. That's why I highly recommend that you read the role player notes to understand what he is supposed to say to you whenever you ask about the psychosis. So there is psychosis here. You should have digged more, particularly the nihilistic delusions. Other than this, everything is okay. Other thing, I feel that you but you did not ask me about drugs or alcohol. Also, this is a very important point.
Yeah.
Another point, you did not ask me how the baby is doing.
Sorry, what?
How the baby is doing, because she is now she is not able to take care of him. So exactly what's going on? So is he suffering from malnutrition? Is he sick? Okay, just ask him. So how is, I said to him, and I have ideas of ending his life. Okay, so these are the 3 points which you should take care of. But otherwise, it was very good, very good. Okay, thank you so much, Dr. Ayman. Give him feedback, doctor. Give him feedback. Very helpful to give feedback. I think we should ask the normal voice. Going through delivery, especially. Okay, there are many ways, but very good, Dr. Aya, that you are trying to engage the patient's experience in your discussion and how you are doing. That's very good, very good. Okay. Well, Dr. Irshida, as I said, there is high risk. according to your risk assessment, definitely, and this patient definitely has high risk, you should say that this patient, say to him or her, it would be better for you to stay in the hospital because it's much safer for you and the baby, and we will take care of you and also the baby in the hospital. So this is how you don't terminate the station openly, and you don't pay, showing that the high risk did not move something in you. Because from my experience that it is very important for the Royal College to give the pass to the candidates who show that the risk issue is in their mind. So if the patient here is showing a high risk and you did not talk about admission, this is not in your favor. Okay, so I think after Dr. Ayman, who was clever enough, I think very good. I hope that you watch his performance. I think Dr. Henry, that's after him.
Yeah, my station is Hypomania, the assessment medical records.
Hypomania? Okay.
Yeah.
Okay. Hypomania. Yeah, this is also a station which usually comes. Please pay attention to the role player's note. Okay.
Okay. So what's your name?
His name, my name is Mr. White.
Mr. White.
Yeah. Ready?
Okay.
Okay.
Yeah.
1, 2, 3, go.
So hello, Mr. White. I'm Dr. Hui, one of the psychiatrists from the mental health unit. So I
Hello,
understand
doctor.
that you're local to.
Yeah, hello,
Yeah,
doctor.
hello.
I really appreciate that you accepted talking with me. I expect from you to give me the chance to have an access to the patient's record, because this will help me to set the plan to help all the patients. I have a plan to help the patients to decrease their waiting time in the waiting room. You know, I had a grandfather who suffered too much because he was waiting too much in the waiting room before going to the geriatric OPD.
Yeah, so yeah, thanks, Dr.
You
White.
know,
So yes, okay, yeah. Okay, so yeah, I understand that you have a lot of of thinking. So may I know, like, why do you want to so you want to access to the medical records, right? Because you want to help the elderly, right?
Yeah, because I have a plan which will help the patients and also will help you, doctor, in order to make sure that you will manage your time in a more efficient way. This plan will help the patients to go in a very organized way to the doctor without wasting time. And who knows, maybe this will be implemented all over the NHS, and the WHO also might also accept it, because this will help the hospitals to work more efficiently when the patients do not wait too much in the waiting room. We don't know the extent of suffering of the patients in the waiting room. As I said, I have a grandfather who used to suffer too much because of this.
Okay. Yeah, maybe yeah, we can talk more on that, right? So how long do you have such plan actually?
Well, 14 days ago, I started to have this idea because I'm a computer technician. I had 30 years experience in programming. I used to work to Microsoft and large companies.
Okay, yeah.
So I have a lot of experience in this issue, and I feel that I should implement this experience in helping the society. As I told you, my plan is not very difficult, and who knows, maybe I will put your name on the name of the program also.
Okay, yeah, thank you, Mr. White. So, like, can you tell me, like, do you think you have like some special powers or some special abilities that
It's
you
not
have
a special power. I'm a normal person, but in my field, I feel that I'm different because, as I said to you, I have 30 years experience in the field of programming, and I also set programs before like this and decreasing the waiting time for airports. You know that these programs
yeah,
will be implemented. So if you
okay,
applied it in your clinic, definitely you will feel
okay,
difference in
yeah,
your,
thank you,
time management.
yeah, Mr. White, thank you for your ideas. So maybe, yeah, we would like to see other things that how we can support you. So, can you tell me, like, how's your mood been recently? What do you think?
Well, my mood definitely is better now because I feel now that I'm able to implement my knowledge in a better way, doctor. Okay,
Okay,
so
yeah, so
definitely this is the way which will help me to help the other patients.
yeah, okay, so since your mood is quite good recently, so how about your sleep?
Well, I used to sleep about my regular time from 6 to 8 hours. Now only 4 hours are enough. And I think this is because I have, a target in life. I have an aim. I have a goal.
Yeah. Okay, I see. So how do you think about your energy if you said you don't sleep well?
Well, my energy level are good, though I'm 50 years old, but I'm able to do this large project because I used to do it. It's not the first time.
Yeah, okay. So recently, are you like able to think clearly?
What do you mean? I'm not crazy.
Yeah, like do you think like you have a lot of thoughts in your mind, or yeah, because I've just said you have shared with me a lot of thoughts, right? So do you think like your thoughts like increased recently or so? Or
No,
many
I
thoughts
don't have.
inside your own?
No, no.
Okay, I see. Okay, so there's some questions that I would like to ask, like do you like hearing some voices when there's nobody around?
I'm not crazy, doctor. I'm not crazy. I'm
Oh,
not
this is
crazy.
some questions that we would like to ask. Like, do you feel like in control of your own actions also?
Yes, definitely, doctor.
Okay, I see. Or like, do you think your thoughts like being interfered by some like other external forces also?
No, I'm a normal person, doctor.
Okay, yeah, okay. So that's good to know. So I see you have a lot of thoughts, right? So and yeah, so like with these thoughts, so like now some people when they have too many thoughts, so like they may have thoughts like to end of one own life. So does it happen to you?
No. I don't want to end my life. I want to help the other people, other patients, doctor. What are you talking about? I don't
Oh,
have any problem with that.
okay, yeah, that's good to know. So like have you like got into trouble with others or so?
What?
Because have you ever got into trouble with others?
No.
Okay, yeah, that's good to know. So like okay. So like how like so you have a lot of planning also so-called thoughts, right? So how do you cope with your daily routine these days?
Well, as I said, I'm a computer technician, but I've been terminated from my job. They did a cut down about 1 month ago. So I've been terminated by my job, but the good thing that now I can apply my knowledge and my experience in a very beneficial field like helping the patients. And I hope that you understand this is not because I have my own financial support. I don't have any problem with it yet. But this doesn't mean that I stay at home, definitely. Someone can benefit from my knowledge. 1 minute remaining.
Okay, I see. So like have you take any alcohol or some street drugs?
No.
Okay, yeah, that's good to know. Okay, so yeah, so Mr. West, so thanks very much for talking to me today. So yeah, we think that you may gone through like have you been at like a I guess like talk to the psychiatrist before, or have any mental health problem?
No.
Okay, yeah, that's good. So yeah, we worry that you might be having like a condition what we call the hypomanic. Yeah. So yeah, perhaps we can arrange another session with you and we can have talk to you more like how we can help you and support you, or like we can help you with your situation. Yeah.
Okay.
Yeah, okay. Thanks for talking with me. Yeah.
Okay. How do you feel about what we give him some feedback? Okay. Now,
Mm.
well, give me the feedback. First of all, give me a feedback about what you did. Give me your own feedback. How do you feel about what you did?
Yeah, I feel I feel like a bit difficult, like to interrupt especially for the first 3 minutes. Yeah, you keep talking and how to like interrupt politely.
Yeah, exactly.
Yeah,
This
without
is
making it.
yeah,
I
very
think
important.
need to have the skills. Maybe I would like to hear like how you suggest like how I should interrupt at that juncture. Yeah.
What you are talking about is how to take control in this type of stations. So the scenario and the role players instruction are very carefully written to challenge your skills. So in the mania stations, you are expected to demonstrate particular skills like taking control of the situation. Okay, so this is a man who keeps talking and talking and talking. Eventually, he does not come up with very beneficial information. Just he's talking all over the place. So you should stop him. You should take control of this discussion by simply addressing his name. For example, Mr. White. Mr. White, whenever you want to start talking and stop him, just start by addressing his name. I felt that you were really struggling. I don't know the technique. It needs some practice. Don't try to interrupt the patient by talking, but interrupt him by addressing his name. He will stop. This is a very polite way. Okay, so pay attention to this.
Okay.
And let's see, the patient is going to distract you, and once you comment on the way he's talking, he will stop. He will stop talking in this way if you don't comment on it. And this is something which you didn't do. And part of the mental state examination is to comment on the general profile of the patient and how he talks. Very important to comment on how the patient talks. Also, I think Dr. Ayman in the past station, he did not comment, or he commented, not comment on the profile of the patient, which she appears to be sad, and she's talking in a very monotonous way, a very sad way. So you should comment on it. This is part of your mental state assessment. Okay. First of all, you want to know exactly his complaint, and while you're taking the complaint, you will notice that he's talking too much. Okay, so you can use this point in order to go further in your mental state examination. I can see like saying, like, I can see that you have a lot to say and you seem to have a lot of energy. Okay, so what you did now is that you commented on the speech and the general attitude of the patient. He will be fidgeting in the station. Do you feel also that there are a lot of thoughts in your mind? Do you feel that they are racing? So what I did now is that I commented on his speech and general in one sentence. Okay, so when the patient is trying to distract you, you can use this event, which can be troublesome to someone else. You can turn it in your favor by asking and commenting on his speech and commenting on his mental state like this way. And now you want to know when did this thoughts or plans started, any other projects. So we want to know more. It was a mistake. I said 14 days, only should be 4 days. Otherwise it can be mania. So you want to know how was he doing before that? You will discover that he has been diagnosed with a mood disorder and he stopped taking his medication. So very important, and these are the points to ask about how was he doing before the onset, because these are the points which makes a candidate different from them. Okay, so pay attention to this. Please, when you start talking with the patient, take the complaint in a very organized way, and believe me, it will help you eventually to cover most of the tricks of the Royal College, because most of the tricks of the Royal College are in the area before the onset. And if you find here, this man has been diagnosed before as a patient who has been had mood disorder, and he came to change his diagnosis, something like this. In this in this role players knows, you find this information. So when you start talking with a patient, put in your mind that the first thing, I'm going to take a complaint in an organized manner. This is my way of starting to talk about with the patient. You take the onset, the course, the duration, and how was the patient doing before the onset. This is the very first thing which you should do. And while you are doing so, believe me, you will cover very important points in the mental state examination. After taking the complaint, it's very obvious now that this is a mood problem. So you want to ask about the mood issues and pay attention to this. In this station, because the patient is trying to distract you, if you don't have a solid way of assessing the mood in mania, you will forget important points in mood assessment, and this will not be in your favor. So this is my acronym in assessing the mood of a patient who is manic, meet MAXA. Each one of these letters stands for a point which you should cover. How was he doing? The energy, anhedonia, and new interests, very important. If the patient is having a new interest or no, most people who have mania started to have new interests, very expensive interests, and buying new sports sets, something like Buick, new racing cars, something like this. Thinking already assessed the mission. So what is his mission from his plan? If he has abilities, what is his abilities? So if, and maybe he feels that he is able in doing something else. And this is different from asking him, do you feel that you are special? Okay, so it's not about being special. So you told me that you are going to do a very important plan and implement it. So do you feel that you're able to do this? So other than being good in computer issues, any other abilities you have? Can you tell me more? Ask about the abilities, not specialities. Okay, mission, abilities, confidence. If you, very important, it's not very important, but when you ask him if he is very confident in doing so, he believes that he is able to do so, his confidence definitely reflects his mood. Sleep and appetite eventually. So as you can see, there is meet MAXA. This is the acronym. And believe me, if you don't write this acronym or any acronym in you choose, which you choose in the notes before going to a station of mania, particularly mania, you'll forget what you're going to ask about because of the anxiety of the exam in general, and a patient who intentionally is trying to distract you. If you don't have this acronym in your mind and in your hand, you will lose track. Okay, so this is how you assess the mood. We said we start by taking the complaint in an organized way, assess the mood, and then you have the psychosis enough to ask about persecution and perception. You'll not have time in this type of stations because of the lot of distraction, okay? And then the cognition, very important to ask about the cognition in this type of stations because of the type of psychopathology. He is more forgetful, impairment in concentration, and so on. So I think that you did not ask me about the, did you ask me about the psychosis? Dr. Henry, did you ask?
Just the point, not the persecution, yeah.
Okay, so cognition, very important to ask about here. Coping and risk, ask me if he is definitely in this type of stations, also to ask me about whether I'm taking any type of illicit drugs and other sorts of risks like involving in new intimate relations, and try to be very sensitive while you're asking this question because it's related to his personal life, okay? And ask him if he has been spending too much. So there are other issues other than physical risk, okay? Like going through unhealthy relations, financial risk, and so on. And regarding the overspending, I think it's written up there also in the patients that he spent 1,000 pounds donating on charity. Okay, so when you assess the risk, try to be more comprehensive. It's not only about physical risk and fatalities. Thank you for this information insight. Ask him if there is anything. This could be tricks played by his mind. Okay, very important to us. This is something which you do not assess. And eventually said that it is a hypomanic episode, very good. Okay, but you do not assess the insight and you do not assess the other points which I've mentioned. Again, these are refreshing visual materials. Please, when you prepare for the task, never go through textbooks. Don't go through textbooks. This is not an oral exam. Many, particularly the new candidates, do this mistake. They go through textbooks and prepare for the subjects of the stations from the textbooks. It's not like this. It's a game. It has particular rules which you will understand with more practice with your colleagues. If you want to refresh your memory enough just to go through some visual materials like this, don't waste your time. Focus on practicing and how to show your clinical skills. Okay. Thank you so much, Dr. Henry. Very clever.
Okay.
That you
Yeah,
found
thank
it
you.
helpful. Okay,
Yeah.
thank you so much. Who would like to go next? I think Dr. Patricia now. This is the Patricia. Yeah. How
Hi.
are you? How are you, doctor? So what is your station, doctor?
I'm a station on the 16-year-old girl with mania.
Yeah, very close to the station which we have just discussed.
Thank you.
Yeah. I'll give you just time to read the case synopsis as much as you can to understand what the role player is going to do.
May I have her name, please?
Okay, let's say
As the
that her
girl.
name is, well, just choose a name, no problem. Choose a name and I will say. What?
Okay.
Okay, so
Choose Amy.
Amy, okay, Amy. Amy. Okay.
Okay. So I start now.
Okay, are you ready? Just you can have a look at the scenario. Very important to
Oh.
understand what the role player is going to do.
Mm.
You don't need any surprises at the station. Ready?
Yes, okay. Hello,
Okay,
Amy.
one.
I'm Dr. Wang from these
Hello.
Okay.
Okay, go.
Hello, Amy. I'm Dr. Wang, the psychiatrist of this hospital. Let's have a chat today. How are you?
Well, I'm very happy to talk with you. At least someone is trying to understand my problem. I want to help the elderly patients. I had a grandmother who passed away, and I really feel so sorry because I was not able to help her. Maybe I can help the other patients like her. I did a lot of work in order to be able to help the medical staff in helping the other patients, doctor. And
I see
I
that
feel
you
that if you give,
I see that you have been talking quite fast with a load of ideas in helping others. So for how long that you've been feeling quite excited recently?
well, I feel that it all started about 6 months ago after the death of my grandmother.
So it's been started after a stressful event.
Yeah,
So
yeah.
besides from feeling very excited, is there any time that you feel that your mood is quite low?
No, no, no. In the beginning, I felt that low, but after that, I felt so good because I felt that there is a way by which I can do something for my grandmother by helping the other patients like her. I did timetables and stuff, rotas, and I spent too much time in trying to help to configure the plan, to help the nursing staff, to help the elderly. And if you give me the chance, I'll explain to you how. You know, there are many ways by which the staff can do rotas, but at the same time, they need to decrease the time in which they rest in order to make sure that they will cover more patients, because the patients need that support, though they will be a little bit tired, but this will be
I
in
can see that
favor
you
of
have a
patients.
lot of specific plans to help others. I can see that, and you have quite a lot of energy. So,
Yeah.
do you have any special powers in helping others?
No, I don't have special powers, but I feel now that because I spend too much time in try to studying and analyzing how I can help the patients, I can put a framework in order to help the patients. And if you just give me a chance, I will explain to you also that how this will also raise money, because definitely it will be adopted by the other hospitals and we can
Sorry
give
to
this money.
interrupt. How much did you spend in helping others?
Well, I only sleep 2 hours at night, doctor, because I spending I spend most of the time trying to arrange these plans. For 6 weeks,
Okay,
I will not be sleeping for 2 hours only.
okay. That sounds quite stressful actually. How's your appetite?
Well, I eat, but not as before, because eating now can be a waste of time. I lost about 2 kilograms, but I
Mm,
can I eat.
okay, so there's some weight loss as well. So I can hear that your thoughts are raising. So um that's a routine question to ask. Do you feel that there are some people harming you these days?
No, no,
Okay. So do you feel that there is anyone interfering your thoughts?
no, no,
Okay, or some your thoughts were being in control by others.
no, no, no,
Okay. So have you been using any illegal drugs recently
no, 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 no,
or alcohol?
no, no, no.
So can you share with me what do you think about your condition?
Well, I feel that I don't have any problem, but the problem is with my mother and father, who does not seem to be listening to me, and they do not
Mm,
understand me.
do you think that you might need the help from a psychiatrist like
No, no,
me?
I'm not crazy. I only want to help the elderly and the patients.
I can see that you have a good heart. So have you been engaged in some activities that is a little bit dangerous recently?
Well, it's not. When my mother and father put me on the edge, you know, I just sometimes I threw plates against the wall, but I don't want to hurt anyone.
Okay, so I can see that you don't have the intent to hurt others. But have you been hurting yourself recently?
No, no,
Okay, so have you thought that your life is not worth living?
no, no, no. I feel that my life is important because I'm going to help the other patients.
So I can see that you want to help others, but did you drive recently? Um recently?
Did I do what?
Did you drive a car recently?
No, 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 no. I don't drive.
Okay, okay. So as hi Amy, it's a pleasure to meet you today. I believe that you're having a condition which we called mania, which is their mood goes high and very excited, which is not as usual. And this is a kind of condition that needs to stay in the hospital
1 minute
to
remaining.
receive treatment. So are you with me so far?
I'm not crazy, doctor.
I understand that it might sound a bit stressful, but we want you to catch some sleep and able to calm down. And I would be very need to talk to your parents to discuss how we can help you. So so thank you very much for talking to me today.
Okay, finished.
Yes.
Okay, so how do you feel about what you did, Dr. Patricia?
Yes, I think yeah, I think it's a good thing that I need to show the condolence, like such as Anya has mentioned. It just sounds so heartless in that case. And I want to actually depict the any depressive episode as well, and to see whether I need to establish something like bipolar. But it seems that yeah, it doesn't go very well.
Okay, so sometimes I feel that you said sentences which I feel not right. You said, I can hear that your thoughts are racing. I don't know exactly what did you mean by that, but you should ask me clearly. Do you feel that you have a lot of thoughts in your mind and they are racing before coming up with a conclusion? They don't express your understanding of this symptom by saying, I can hear, because the examiner, like what I did, will say, how can she hear her thoughts? You can see that I can see that you have a lot of thoughts and they seem to be racing, okay? You were checklisting. At the end, you said, hi, Amy, again, doctor. Pay attention to these cultural differences. Hi is not said at the end of the discussion. They didn't ask me about how did this impact her life. This girl has left the school. She's confined in her house. There are a lot of problems with her family because she is totally dedicated on setting plans and rotas for the medical staff. Let's see the feedback of our colleagues. Amanda stated about it's MSE. Okay. Okay. I gave you a very good feedback. Pay attention to it. And Dr. Santos, this is very good. For me, Dr. Santos, it's very clever. As I said, this type of stations, they assess your skill in taking control of the discussion. As I said, whenever you feel that the role player in a mania station or hypermania is talking too much, interrupt him by addressing his name and ask your question, okay? Very important to do this. Don't start talking while the patient is talking. No, you can address his name in order to give yourself a chance to talk. Okay, let's go through our okay, so let's see. The notes, if you have a same way of assessing the mental state in this station is the same way like the previous station, okay? When you are taking the complaint, you will pay attention to how the patient is looking. She will be fidgeting or showing that she has a lot of energy, comment on it. When she starts talking, definitely she will show a pressure of speech. Interrupt her by the way which we have discussed, by addressing her name, and comment on this by saying that she has a lot of thoughts in her mind. And you feel that they are racing also, so you have commented on her energy, on her general profile, and the way of thinking and the speech. And you want to know more about these projects, how did they start, when, and do you feel that with time that she is more preoccupied, and if she's having any other projects, and you want to know if it started X months ago, how was she doing? And you'll find that she was so sad because of the death of her grandmother. Believe me, this is a trick which is put in the stations. Definitely, always before the onset, there's something left for the candidates who are clever enough, who can be considered as a member of the Royal College, because the Royal College is totally preoccupied by the issue of predisposing, precipitating, perpetuating factors. And precipitating and predisposing factors, all these are related to the area of before the onset. So before the onset, usually there is something there, from my experience with the Royal College, left for the candidates who are clever to pick up these clues. Okay, so as again, doctors, in this type of station, write down the points which you are going to ask in the assessment of the mood. Otherwise, you will be distracted. So same thing like the other station, meet Maxa, you want to ask about the mood, the energy, anhedonia or new interest, thinking, which you have already assessed, mission, abilities, confidence, sleep, and appetite. So these are the points which you should cover, and you should cover them in one chunk. Don't go back and forth and appear as if you are disorganized. That's why you should write down these points in your notes before going into the station. Psychosis here, enough to ask about the persecution and perception. Did you ask me about this, the persecution and the perception?
I've only asked persecution.
Okay, so very important also to ask about the perception, if she has been suffering from any unusual experience, because she is not sleeping, and put in the your question a piece of her experience. Otherwise, you will get a checklist feedback. Now you know who are the candidates who get a checklist feedback. Those who list the questions without paying attention that these questions should be related to the patient's experience. You'll get the checklist feedback, okay? Cognition, definitely, this is a very important issue or point to cover in the mental state when you are assessing the patient who has mania. If she is forgetful lately, concentration, impact, coping, and risk you asked about, and then insight you asked about. Termination, in this station, also very important to terminate. There is high risk here by saying that it would be much safer for her to stay in the hospital until it is suitable for her to go back. Okay? Any question? As you can see, the same assessment, you don't need to formulate a particular dialogue for every station. As you can see, the assessment here in this station, in my note, the same questions goes on this station, like the station of hypomania, like the station of any other mania. The only difference is that in mania stations, you'll find that there is high risk and the symptoms are more severe, but the same questions and same way of assessment. Okay, and determination definitely in mania will be that he or she should stay in the hospital. Okay, yes. Thank you so much, doctor. Very clear. I hope that you found it helpful. Thank you. So who would like to go next?
Hello, Dr. Hussain. Can I go next?
Dr. Santosh, how are you?
Hi, sir. I'm good, sir. Thank you. How about you?
Yeah, alhamdulillah. So
very happy to see you after so long.
Well, inshallah, you'll pass. So what is your station, dear doctor?
This 666 psychosis.
Oh, yes. Okay. So let's see this station. I will just give. Okay, so this is a typical station like before, but you can see in this station, the role player will elaborate more psychosis. So same scenario in general, like he has been referred by the GP, but there will be more psychopathology. And actually, this is a scenario which usually comes, not the other scenario. You may just read down the scenario and arrange your thoughts and write down your notes.
Sir, I'm ready.
Okay. So. One, two, three, go. Let's say that my name is Mr. Brown. 1, 2, 3, go.
Sir Abraham.
Hello, doctor.
Okay. Hello, Mr. Abraham. I'm Dr. Santosh, one of the mental health doctors, and I understand that you had some difficulties at GP's office. I'm here to
I don't
understand.
have any difficulties. He is a totally irresponsible doctor. I discussed with him my concerns. He didn't understand me, and he said that I will not take any service from his facility except after talking with you. That's why I'm here. I don't want to be here. I'm not crazy.
I'm really sorry if I have made you feel this way, Mr. Abraham, but I'm here to help, and I'm here to understand what and all happened at GP's place. Will that be okay if I ask you some questions in that regard for that?
Okay, no problem.
All right. So can you please tell me what happened there?
Well, I was supposed to do some blood tests because I feel this terrible headache, and they brought for me this test tube, and I noticed that there is 666, which is satanic sign. Everyone knows this satanic sign, and there are a lot of satanic issues going on. I said to him, I don't want to put my blood in this test tube. He must bring another test tube. He said, no, this is your name on it with this particular barcode. He insisted, and I also have a right to insist. And eventually he didn't accept any explanation, and he said that I will not take any service from his facility.
I'm really sorry again about what and all happened there. But I was wondering, you said that you were worried about this code 666 over this while. Is that right?
Yeah.
Okay. And you said that it is satanic number. Is that right?
Yeah.
So how long have you been believing this way?
Regarding what?
This 666.
Well, it is written in the Bible.
Number.
I have the Bible in my hand, doctor. If you can say, I have the Bible in my hand, and I follow the word of God. And since I've been committed to going to the church 6 years ago, I've noticed that this satanic issue is there in the Bible, and it also is everywhere. God made us aware of it, but people do not pay attention to it because they don't follow the word of God. 6 years ago, I started to pay attention to it, and I don't do anything related to this satanic issue.
Right. Mr. Abraham, you said 666. Apart from you, is there anyone else in your family or in your community who believes the same?
Well, they say that it is written in the Bible, but they are not committed like me. I decided to be following the word of God as it is. Anything related, anything evil, I should be away from it.
So you seem to be quite a religious person. You are carrying a Bible, and you are quite following the Bible and Word of God and 666, I can see. So with all this, suppose if the GP had to offer you another vial with a different number or a different barcode, would you have given your blood into that?
Yeah. But after what he did, now I'm very skeptical. I don't know. Maybe he is one of them. Why did he insist on putting my blood in this particular test tube? I don't know. I don't trust him anymore right now.
No, but why GP will do this?
I don't know, doctor. You should ask him. So if it is feasible to put my blood in another test tube, why did he insist on putting my blood in this test tube?
Okay. So do you think that maybe the GP is trying to harm you in some way?
Well, definitely. I've started to have headache and being tired about 1 week ago, and I feel that they have some evil force trying to put some microchip in my head in order to stop me from revealing their plan, doctor. Because I'm now able to pick up these codes everywhere. I can pick up them in the barcodes in the supermarkets and in the in the panels, advertising panels, and so on.
Seems you are struggling at the moment.
Well, I feel definitely I expected some medical help, but not from him. Yes, definitely I'm struggling because they are everywhere.
So regarding this chip, who has put this chip to you?
maybe them, the Satan has a lot of followers, and I feel that they understand now that I'm able to pick up their cause. That's why they want to stop me.
But why will they do this?
To stop me, doctor, because I'm
Right.
revealing their plans, their evil
Mhm.
plans, like what happened in the clinic. They
So,
are
Mr.
going to
Abraham,
take the
let me
blood of
interrupt
evil
you.
person. What?
Right, Mr. Abraham, let me interrupt you and ask you that is it possible that you're mistaken and all this is happening because you're not well in terms of your mental health?
No. I'm sure.
All right, okay. So apart from this, do you think that you got special energy or powers because you're quite a follower of God?
No. I'm a normal person, but trying to follow the word of
Mhm.
God.
Sometimes when people are distressed, they have some unusual experiences like hearing voices when no one is around. Is that the case with you?
No.
Or any, do you see something which is not seen by others?
No.
Any odd sense of smell
No.
or taste
No.
or touch that you have?
No.
Okay. Mr. Abraham, I was wondering, sometimes do you feel that you said that they
1
are
minute
trying to
remaining.
control you? Do
Yeah,
you feel
definitely.
that
They want to control me by this chip, which they set in my mind.
do you think that they're interfering with your thoughts with that?
Who knows what they can do with this chip?
Mhm.
I don't know.
How your mood is?
My mood is fine.
Are you sleeping well?
Yeah.
Eating okay?
Yes.
Any thoughts to hurt or harm GP because he's
No. I'm
maybe
a peaceful. No. I'm a peaceful person. Just try to
any
avoid
thoughts to
them.
hurt or harm yourself, Mr. Abraham?
No.
Mr. Abraham, it seems to me that what you are experiencing currently is psychosis. And let me pass on my findings of your assessment to the GP. Let me speak to you after speaking to the rest of the team. Thank you, Mr. Abraham.
Excellent. How do you feel about what you did? It can be better. You can do better. So how do you feel
Yeah.
about what?
Yeah, I think inside question I did once while I
Too
was
early. You
exploring
asked me
chip,
this
but
question too early.
yeah, and yeah, I could have offended role player easily by then. I could have done it a bit later. And apart from that, substance abuse I could not do because of lack of time.
Okay.
Yeah.
Okay, so I want just you to pay attention to what is written in the role player notes to understand that when you take the complaint, it will help
Yeah.
you to pick up the tricks of the royal coach. Okay, so as you can see here, what they say here, when you dig more in the sequence of the event, you will find that there has been some sort of delusional mood, okay? And eventually this feeling cleared once you realize about the barcodes, okay? So you can guess here, so what is going on? This is not a mental state, this is a history-taking scenario, but it is now put in the mental state examination role in the role player notes. So what's going on? What's going on is that there is no clear-cut line. You can't say there is no black and white. When you
Yeah.
take the complaint in a proper way, you will pick up these tricks. So how were you doing before that? So he started to feel headache 2 weeks ago. So can you tell me more about this? So before the 2 weeks, how were you doing? He will start talk about feeling odd and so on. And once he started to pay attention to the barcodes, everything was clear. So when you take the complaint in a good way, definitely you will pick up the tricks. And as you can see, it's all about the area and the time bracket before the onset. Otherwise, it was good, except that when you ask about the psychosis, please put the patient's experience in your questions. Like, so tell me more about your experience. So have you ever heard the voice of Satan or any demonic voices, any experience with the Satan, like hearing him or seeing him, any other experience on your body because of this satanic issue. So put in your question a patient's part of the patient experience to avoid the feedback of being checklisty. Okay, now we know what is checklisty and how the candidates can get a feedback of checklisty. Please don't be one. Otherwise, it was very good. I don't have any comment. Just try to be more. Okay, Dr. Santos is very clever. If you are lucky enough, he can be your study partner. Okay, so thank you so much, Doctor. Thank you so much. Who would like to go next? Who would like to go next? Ian. You. Okay, so it was mute. So please, please unmute them.
Okay, yeah, I'm on mute now. So can I go next? I had preferred for this session, this one, Postman Psychosis, I think.
Postman Psychosis. Sorry, because your name is not written in your in the.
Okay. In the group, I had just gave a screenshot of that Google sheet.
Yes, dear,
where I
but
put my name there.
in the Zoom, you are just by the key. You are appearing with the name of user, the Zoom user. So I don't know your name. So no problem.
Okay.
Okay, so we will do the Postman Psychosis. Okay, so this is a very important. All of them are stations which usually comes.
Yeah.
Ready?
Yeah, we can go.
Okay, let's say that
So,
my
the
name
name
is Johnson.
Johnson. Okay, yeah, that'll do.
Okay, 1, 2, 3.
Hello, Mr. Johnson.
Hello.
I'm Dr. Sharma. Yeah, hi. How are you?
Well, I'm not fine. I said everything to the police. I cannot live like this anymore. Though I didn't do anything. They keep blaming me for everything, but I didn't do anything, and I confessed everything to the police.
No, I can see you are so distressed. I can just guess it by the words you are saying. You are looking so distressed. And I'm just introducing myself. I'm Dr. Sopanjit Sharma. I'm a psychiatrist in the department. And the police had brought you earlier. You had yourself surrendered to the police, and they had asked me to have an evaluation regarding what you are doing on your mental health side. Is it okay if we had a talk regarding this?
Okay, no problem. No problem.
So you said, John, that you have surrendered yourself, and you just suddenly said that you are having guilty for doing this terrible crime and all.
They keep blaming me for the work between Ukraine and Russia, and blame me and say that I carry the responsibility for all the fatalities in Ukraine. I didn't do anything.
Okay. No, just I can understand the distress you're going through. Just it'll be helpful if you can just let me know since when you're having these thoughts.
About 6 months ago. 6 months ago.
6 months ago. Okay. Anything happened during that time in your life?
I found that they were talking in the TV about a letter which I've lost. It was supposed to be a letter sent to the Russian embassy, and they keep
Okay.
referring to it and blaming me in the TV. I don't know how
Okay.
did they know, and they say that everything is related to this letter which
Okay.
I
Okay.
lost, and they blame me for all the fatalities.
Mm-hmm. So I'm just so sorry to hear about all these things. You are keeping referring for them as they. So may I know who are they?
The news anchors in the TV, they keep talking about this letter which I've lost. I told my boss,
Okay.
and they said that this is not an important issue because it was, a
Okay.
ceremonial letter. It is not that important. But
Mm-hmm.
I don't know why they blame me.
So why do you think that this misplacing the letter would have given rise to the situation? Why do you think like that?
Excuse me?
Why do you think that you're this misplacing the letter, it had given rise to this war situation? What led you think that?
Because they keep talking about it in the news, and they blame me.
Okay.
I don't know why they are
Okay.
blaming me.
Okay. And since last 6 months, if you don't mind me asking, how do you find people? Are other people are also talking regarding these things?
Well,
Are
the
people
police
who
keeps
are
following me, doctor, also because they want to know how
police
I
keeps
was
following
involved
you?
in this. I
Okay,
cannot
it's
live
so
like
terrible.
this, and they
Yeah,
keep
yeah, yeah.
blaming me. The police is following me everywhere.
Okay, okay. And how convinced are you that this actually happening? Can there have been altered
I'm
explanation for all this?
100%. I'm 100% sure because there is a police car following me everywhere, doctor.
Okay,
And
I'm so sorry for
I'm
this.
staying in the house for 6 months now.
For 6 months, you are not stepping out of the house.
Yeah, because the police is following me
Okay.
everywhere.
Then how you are managing your food and your groceries and all these things?
I only ask for the delivery, but I can't live long like this. I don't have any cash anymore.
No, obviously I can understand. So you are saying that you are hearing them talking regarding you in the news also, the police also. May I know a little bit more about this?
Yes.
How you know they are talking? Are you hearing them talking to you?
Yeah. In the news, whenever I open the TV, they
Okay.
keep talking about. I stop watching the news.
Okay. So they are directly talking to you, or they are talking among
No,
themselves?
they are hinting, but I can understand that they are talking about me and the letter which I have missed.
Okay, okay. And is it that whenever you're hearing them, is it as clear as you're hearing me now?
Yes. Sometimes it is in the TV. I stop. It is very obvious.
Okay,
Sound
okay.
of the
And
TV.
yeah, and apart from the TV, you said police are also talking about you.
Yeah, they
So
keep
that
talking
you also
about me,
hear?
and I can hear them whispering in my room, talking that we must stop him. He must not
Okay,
be able and be
it might
allowed to
be
do this
very
again.
horrible for you. Yeah.
Yeah.
So do you see them? Do you see them when they talk?
When I go out, they look at me in a very peculiar way, as if they saying to me that we understand what
Okay,
you are doing. I can read it in their eyes.
okay, okay. Okay, it's so distressing for you. Do you in any other way feel that the police or the news anchors, they are able to manipulate your thoughts in some way? They're controlling your
No,
thoughts also?
no.
Okay. And with all this distress, as I'm saying, how you are coping with this? Because you have already said that you have stopped going out.
I stopped going out. I keep just taking food just by orders by the telephone in order to avoid anything, but they did not stop. They keep
Okay,
harassing me.
okay. How do you feel nowadays? How's your mood?
I feel so low. I'm frustrated. I want to get rid of all this. I decided to confess everything.
So when you say get rid of it, do you feel at times that there's no point living this life anymore?
No. I just want to live peacefully.
Okay. And just don't mind me asking, have you ever crossed your mind that you would like to confront those people or harm them in any way who are doing this?
No.
Okay. Thank you, John, for giving all this information. Just, I would like to ask you, can it be in a way that you are having some difficulties in your thinking process because of all the stress. So
I don't know, doctor.
is it because of
I don't know, but I can't continue like this.
Yeah, I understand the stress, and definitely I will give the feedback back to the treating team, and I'll seek help from the police also, how best we can go in regard of your help. Thank you for all this information, doctor.
How do you feel about it? Very good, very good. Have you ever been to the course before?
Yeah, this is my second attempt.
Yes, very good. You did it in a very good way, actually. Very organized. You covered everything in 7 minutes frame. You covered it in depth, and your priority was the psychosis. Very good, very good. I don't have any feedback to give to you. Very good, actually. Anyway,
no, but I failed anyway. I failed 6 stations last time.
I passed from the 8th time, so everyone has his own time.
Yeah.
Okay.
So, apart from what I feel that I might be little bit hurrying towards the end with the mood symptoms and all, and also risk part. Although I feel like I'm hurrying a little bit.
No, it was perfect. You gave me the chance to talk, and you commented on the psychopathology, which I was evolving. Everything was good. Okay, and even when you start, you showed empathy. Very good start.
Okay.
By the way, your introduction and the way you start the station gives a good impression about you, or a bad impression, and usually first impression persists. So if there's any chance that you outshine in the very first 2 minutes, just don't lose this chance. Showing empathy, showing that you understand the situation. Many ways you can show that you are good candidates in very 2 minutes, very first 2 minutes. Other than this, I don't have any feedback. Very good, very clever doctor. What is your name, doctor?
Thank you, sir. I'm Swapanjit Sharma. Dr.
Sharma?
Indian.
Dr. Sharma?
I'm from Kolkata, India.
Yeah, okay, Dr. Sharma. Because just said here to Zoom.
Sharma.
Okay, thank you so much. Very clever. If anyone has any feedback to this clever doctor, please. It will be helpful for everyone. Okay. Okay, so who would like to go next? We only have one station left. Anyone wants to do this station? Have we finished? Okay, thank you so much. Please, doctors. Well, I have you just pay attention to this and just make it a very clear issue in your mind when you are preparing. Now, the Royal College is changing the scenarios and changing the they bring new stations. Sometimes they change the topic of the scenario, which you know already. So encountering a station which you already know 100% in the task is not going to happen, most probably. So what we are going to do here, that we are trying to practice how to perform the task properly. They can change the scenarios, but they will never change the task. So if you know how to do the task properly, you will know how to do your task, whatever the scenario is. So don't copy paste the scenario, please. Many candidates suffer from this, that they copy paste the scenario and they encounter, even in is totally different scenario, even from those which you get in the SPMM mocks and so on. They intentionally change points in the scenario. But if you have a good construct in your mind regarding how to do a task, definitely this will help you to tackle any station, even if it is a totally new scenario. There are not less than 140 stations out there. If you are starting from now, definitely you will be in a better position from those who start later. A lot of stations which you should cover. And if the more early you start, definitely the more chance you will have at the end of the station of the preparation time to be relaxed and go to the exam more confident. Thank you so much, dear doctors. Hope to see all your names in the post list. Have a good night. Thank you.